Sometimes I think we're preaching to the choir, but it's important that we get these messages out and get them in front of the media and perhaps some people that have no idea what's going on and need to get involved with the situation. I have George from the Letter Carriers Union 115, and he's going to give us a few of his words and his positions on this. As I said, change is happening in healthcare. It's happening now, and we just have to help push it along and do it with a little bit of fight.
Thank you, everybody. I'm actually here for two reasons. Just like a good marriage, you know, a good man and a good woman come together for a wonderful life together. Health care is very important to everybody, okay? I'm here for the Employee Free Choice Act. How do they come together, okay? I'm a letter carrier. I'm blessed that I'm in a union that gives me health care and the right to be in a union. So you put those two together. If we unionized America with the Free Health Care Act, the Free Employee Free Choice Act, employees can ask for a health plan. How simple is that? These CEOs are making, on average, 344 times what the average worker is making. That's just not right. It's not right that they're making so much when the local laborer can't even get health care. Something has to be done. It's turned into an American way of life where the big get bigger and the small get smaller. The letter carriers just had a food drive this last Saturday. There shouldn't be any food drive. Every American should be fed. Every American should have health care. Every American should have the right to have a union if they wish to. And no employer, no matter how much we know their names and their corporations, have the right to take an average American and push them down and where they can't even afford to go to a doctor, get medicine. So all we want is to balance the beam just a little bit more. Fine, let them make 244 times what the average American makes. But please, give something back to the American worker so they have just a little bit more. And I want to thank you. And one last thing, I do have letters to sign to Senator Specter to send a message to him that we want Employee Free Choice Act. And from my union in Washington, they told us as soon as this bill passes, we will be on board full-time for this health care issue. Thank you.
Thanks, George. We appreciate that. Where were all your people today? They needed to come out. You should have gave them letters. Sam Bianca, I want to recognize you as one of the forefront leaders of our area. And if you'd give us a couple words, I would really appreciate it. Thank you.
My words are, I want to tell you something. I used one word when it came to getting a stamp for the miners that we have been unable to, which I'm going to have an article in the paper one of these days. And this applies exactly to what's happening with health care. It's almost disgraceful. And if you notice that health care went up only a small percent, that is only a gimmick for this past year, because they're aware of the fact there's a possibility of a one-payer system, of course, to which I've been an advocate for years and years. And what we want to do is also to get our, not only employers, but the labor movement. Now I have a minimum of 200 central labor councils and locals that have endorsed the one-payer system. And what we would like to do is also get that throughout the country. Because as long as you're going to deal with individual companies, you're not going to have competition. You're going to have a conspiracy how to keep taking more money from you. I'm also president of the retirees program from Northeast Pennsylvania. And the horror stories I hear every time we have a meeting once a month, I mean, if more legislators would be able to attend those meetings and listen to facts of life, I am sure they would have more consideration that health care would become a reality rather than just a discussion. Thank you. Good job. Good job. You're the man, Sam. You're the man.
That's true. The opponents of health care try to scare everybody with denied claims and all kinds of very scary tactics that make people say, oh, okay, maybe it's better if we don't. Those things are happening now. Care is denied on a regular basis with the system we have, and we need to do some reform to help that stop also. This reform is necessary on the federal level, and it's necessary on the state level. We do have I need Bob to come up to speak with us too, but I did want to introduce Carl Romanelli. Carl is with the single-payer healthcare with the state of Pennsylvania, and he's here. He's part of our group also. Everybody seems to be working on in their own little areas right now, but I do want to call for everybody to come together and let's get on our federal representatives and get this happening now. It is the time. This is the place. We can't look back. We have to proceed forward. Carl, if you just give us a word.
Sure. Thank you. Thank you very much. I'm here because, like Roxanne said, what's going on in Washington is involved. It's complicated. There's a lot of politics to healthcare reform. So before we see that on a national level, it will take a while. But right now, right here in Pennsylvania, we could do something today. There is legislation in both the Pennsylvania House and the Pennsylvania Senate that would create a single-payer healthcare system for all of Pennsylvania. This system would provide each and every Pennsylvanian full medical, prescription, doctor visit, hospitalization, chiropractor care, rehabilitative care, preventative medicine, even forms of alternative care, dental, optical coverage, a full comprehensive healthcare system that would cost each worker a 3% tax on your net earnings, on your gross earnings rather, and the employer would pay under the present model and for the first 3 to 5 years a 10% tax, which would probably go down to 9 or 8% after the first few years, because one of the things the bill also provides is money for displaced insurance workers, so we could move them where the actual jobs and demand for jobs in our economy exist, and that is in healthcare. So with Pennsylvania taking the lead, we can conceivably have the first in the nation single-payer system right here. And we could compare a single-payer system after 10 years to the other 49 states, which will continue to be dominated by the health insurance lobbies and the special interests, and see which fares better, the other 49 or Pennsylvania. The big problem in both Washington and Harrisburg right now is the very discussion of single payer is being muted by the same leadership that says it wants to solve this issue. If we want to solve the issue, let's take the model that is 87 for 87 throughout the world in effectiveness and comprehensive coverage for people in other nations, and see if we could do that in Pennsylvania in the spirit of the Commonwealth. Let us take a stand here today and say that the healthcare needs of Pennsylvanians are far more important than the profit needs of nonsensical criminal insurance companies. Call your state reps and state senators and ask them to support this. Thank you.